You're listening to the Chiropractic Connection, a podcast by chiropractors for chiropractors. Happy Black History Month, everyone. This month, we will be focusing on all things personal injury. So sit back, relax, and let's get connected.
This episode is brought to you by myself, Dr. Jonathan Newton, and North Atlanta Spine and Pain Care, located in East Point and the Smyrna Marietta area. As a pain management physician doing injections, I have been working closely with chiropractors for the last decade to ensure the best outcomes for our patients. Your patients will always be your patients. As a proud gold sponsor of the Georgia Chiropractic Association, we look forward to your referrals so you can be at peace knowing we're on your side. To refer a patient to North Atlanta Spine and Pain Care, please email pireferrals@gmail.com. That's pireferrals@gmail.com.
Have you ever wondered what makes chiropractic? We don't always have the answers, but it never hurts to imagine.
Hello, GCA. Welcome to Philosophy in Action. This month's segment, we are going to talk about personal injury practice building. And you say, Dr. Plasker, 100-year lifestyle, lifetime care, that's what you talk about all the time. What does that have to do with personal injury? Well, let me tell you, it has a lot to do with personal injury because people that get injured need chiropractic care. People that are in car accidents need chiropractic care. And there's many different approaches that people take when it comes to PI. To be honest with you, we do not market to attorneys. That is not our thing. We have relationships with attorneys. We have attorneys that refer people to us on a regular basis, but we don't market to them. And what we do is we give great care, and we built our personal injury piece of our practice from people that were lifetime patients that got in car accidents and they ended up coming in for the personal injury piece of it. We sent people to an attorney that we know, that we trust, that we know is not going to negotiate our fee, that is going to look after our well-being as well as looking after the patient, and we refer people to those attorneys. If somebody comes in and they have another attorney that we do not have a relationship with and we do not have a good feeling about it, some of you are going to think I'm a nut job when I tell you this, but we just don't take that case because we don't need everybody and we don't want a bad deal or a bad relationship. We'll happily take care of that patient, but we won't participate in the personal injury game with that particular person because the integrity of our practice is the most important thing. So we definitely get new patients that are in car accidents when we are out in the community. We talk about people that are in car accidents when we are in our office, and we talk to people about the different ways that people get injured. We talk about car accidents, what that means, how it affects people, not just in the immediate present, but in the long term. And so we do love taking care of those people. Now, one thing that's really interesting, we did an interview with one of our 100-year lifestyle offices down in Florida who had a $1 million settlement because they used the language and the understanding and the principles of the 100-year lifestyle to educate the jury. It was a jury trial to educate the jury about why that person's life would probably be altered as a result of the injury that they had. This person had a little bit of degeneration already in their spine. They ended up with an accident that really caused a lot of additional problems to their spine that were going to impact that person. There was an impairment that was going to have a long-term effect on that person's life. And when they talked about the 100-year lifestyle and brought in the reality of that person's life expectancy being not just 5 years, 10 years, but literally could be into their 80 and 90 and even 100 years old, the jury responded and awarded a magnificent settlement. And so it's kind of cool to understand and to know that your philosophy as a chiropractor and understanding the science and the degeneration and the relationship between those injuries and how it can affect people not just in the near term but in the long term can be a game changer. Now, obviously, that person is still under lifetime chiropractic care in that office. We're excited about that because we are all about people having a highly functional nervous system, not just for today, but for the long haul. So when you're doing PI and you're talking about accidents, don't just talk about it. Do not compromise your philosophy or your principles. The science supports it. The life expectancy supports it. The branding of the 100-Year Lifestyle supports it. So for those of you that have been following along with what we're doing and you want to learn more about the 100-Year Lifestyle, go to 100yearchiropractors.com. We would love to talk to you about how, not just with personal injury, but really for your whole practice, filling your practice with lifetime patients, which, by the way, when somebody comes into our office and they've been in a car accident, it is not uncommon that the entire family gets under care because of how they get educated. So we turn one patient into 2, 3, 4, or 5 patients. The other thing that I'll tell you that we have done several times is we've had attorneys, when they learn about what we do and they hear the language and what we talk about from a 100-year lifestyle perspective, they actually bring their own families in for care. So I love it when that happens because we know we're doing the right thing. We're telling the chiropractic story in a way that it's good for the people who are in accidents as well as good for the people that have not been in accidents, and not just for crisis care, but transitioning to lifestyle care so they can live their ideal 100-year lifestyle. So let's get lots of people under care, everybody. Reach out to us if you want to. We're proud to be a sponsor of GCA, and we'll see you at an upcoming event, or reach out to us again, 100yearchiropractors.com. Talk to you later, everybody. Bye.
Who doesn't like a moment to shine in the spotlight? GCA is always ready to give our members a shout out.
This month, we would like to shine our spotlight on Dr. Dawn Samad, owner of Chiro Time Clinics and Chiropreneurs. Dr. Samad is a natural businesswoman at heart. An active GCA member since 2022, Dr. Samad has worked tirelessly to support GCA, her fellow chiropractors, and her community. Her unwavering commitment to the profession is unlimited. This year, Dr. Samad will be the first ever Black chiropractor to run for Georgia State's House of Representatives. We know Representative Dr. Karen Mathiak looks forward to supporting her win. Thank you, Dr. Samad, for all you do for GCA, the chiropractic profession, and your community.
What better way to make every day your day than by learning how to treat yourself? Here is today's wellness tips.
And now for the moment everyone has been waiting for, starring this month's experts.
Welcome back, everyone, to the next episode of the Chiropractic Connection. Happy Black History Month. It is February, so of course that means I had to celebrate my Black African American doctors that are here with us today. So today with me we have Dr. Shawn Jones. Hey, Dr. Jones, thanks for joining us.
Thanks, man.
And we have Dr. Jean-Louis Clarel.
Hey, how you doing?
Hey, Dr. J. Nice to have you here with us today.
Sure.
So we're going to get into the personal injury conversation today. I know a lot of you have asked us about it, and it's a new topic we have not yet covered. So let's get into it. All right, guys. Well, welcome to the podcast. Don't be nervous. Just relax. So I want to ask you both, can you tell us a little bit about yourself, your journey into chiropractic, where that started for each of you?
Well, for me, it started when I was in high school. A lot of my teammates would get hurt at football practice or track practice, and they would always talk about going to see their chiropractor. So I was able to see the difference before they went, and then like almost immediately after the visit, how they would change for the better.
Okay.
So that piqued my interest in it.
Okay. What about you, Dr. J?
For me, I didn't know anything about chiropractic until my senior year of undergrad.
Okay.
I was in pre-med. I had 4 cousins before me who were already medical doctors. So that was the natural progression for me.
Yeah.
But my advisor, whose job was to get us into medical school, she told us about chiropractic and felt that would be a good addition to the profession.
All right. I love that. So then you both are life grads, correct? Were you in school at the same time?
We were.
Okay. So did you guys start together? How did you meet? Because I know you both are business partners. So how did that come about? Did you form the relationship in school? Did you know midway through? When did that synchronicity happen between the two of you?
We met in school. He was a year ahead of me.
Okay.
But we still had a lot of same friends, and we had talked about going to business when we were in school, but didn't immediately happen. It happened probably about 10 years afterwards.
Oh, okay.
Yeah.
Gotcha. So now I know, in school, we're exposed to a lot of different topics, a lot of different ways that we can practice, but you both chose to go into personal injury. Now, I know that it may not have been right away, but with that, how did you, one, come to know about personal injury? Because it's not a topic that's heavily covered in school. And what piqued your interest in personal injury?
I'll say Arrowhead introduced me to personal injury. All the commercials they ran when I was a kid. So
gotcha. Right. Problematic.
Anyway, no. But yeah, that piqued my interest. One of the first offices I worked for, they did a lot of personal injury.
Okay.
I took a liking to it. Started out with wellness, and in school, personal injury was a taboo word. It discouraged a lot of us from going into that particular discipline of chiropractic. I said I started out with some clinics that were heavily into personal injury, and I just saw how we could make an impact more so than wellness, because if you're in a wellness practice, there's nothing really wrong with you. Maybe a little stiffness here, a little ache and pain here and there, but most of our patients that come to our office have some kind of positive MRI, whether it be from a meniscus tear to herniated discs, facet inflammation. So you really get to test your skill set out as a personal injury doctor, because you're taking someone that's been in a recent trauma,
right,
and then you're getting them back to where they were pre-accident status.
Right.
So with wellness, although it's great, I think everyone should be under wellness care. But for me personally, I felt that I could really test my clinical skill set with personal injury.
Okay. What about you, Dr. J?
Well, personal injury was the furthest thing that I wanted to do.
Really? Okay.
Coming out of school, starting a practice, everything was all my resources, all my time were devoted towards wellness. But it only took one or two patients that were personal injury to start paying the bills. So even though most of my time and my resources were going towards wellness, it wasn't paying the bill. So eventually I had to make the switch to personal injury because it was easier.
Yeah.
And it really tested my skills. Because when someone comes in with inflammation, some of the diagnosis that Dr. Jones mentioned, it really tested my skills that I needed to change my approach on how I address the patient in initial treatment. But that's how I came into personal injury.
So why do you guys think personal injury gets such a bad rep? Like what? Because I know what we do.
Right.
I know what I do. I know what both of you do. I've seen some amazing personal injury doctors that have gotten people who have been in severe accidents, whether it's workers' comp related accidents or automobile accidents or slip and fall, patients who come in very injured and leave out very close to 100%, if not at 100%. And I think that's amazing. Yet and still, in this profession, personal injury is not the highlighted avenue. So what do you think?
Well, I think it's several things. First, for a long time, especially in the Black community, the only time people would associate needing to go to a chiropractor is when they were in a car accident. So I think the profession wanted to be, and it's bigger than just car accidents. And I think when people were like, "Oh, when I get in a car accident, I'll call you," and we're trying to shed that whole persona where it's just car accident doctors.
Right.
Secondly, there's been a lot of doctors that were not so ethical in the profession, and they would ambulance chasing doctors.
Gotcha.
Essentially. They were running up bills, overbilling, giving poor quality of care. So that again became synonymous with personal injury.
Okay.
So those two things I think is why, it gets such a bad rap.
Okay. Do you have any thoughts on it, Dr. J?
And I also think it's, in addition to what Dr. Jones said, I also think there's this notion that people were going to see a chiropractor after an injury simply to get paid. And people weren't really thinking of the fact that they actually are hurt.
Right.
Yeah, there are some people who are really trying to just get a check, but that's where I think a lot of people get it wrong.
Yeah.
Because it's not just about the patient getting paid. It's about restoring the health.
Right, absolutely. And I think it's great what we do, because when you're in the personal injury world, you get to see people that you might not normally ever see. They may never walk into a chiropractor's office. Now they kind of, I don't want to say they don't have a choice, but they're sent to us, right? And through what we do in the office, we can teach them about chiropractic. And it's really amazing to me to watch a patient who doesn't like to get adjusted at the end of treatment, love or ask to get adjusted. And then some of those patients end up coming back as wellness patients, whether 6 months or a year later. So I think there's a lot of areas of opportunity in it. It's just sometimes overlooked. So hopefully, if the university is listening, maybe we can offer a personal injury class and do a better job educating students on what personal injury is and also what it isn't and what that care plan actually looks like. So I'm glad we kind of touched on that. So can you talk to me about what, in a day in your office, Dr. Jones, what does that care plan look like for your patient?
Okay, we'll just take a personal injury patient. We typically will do a first day exam. We'll determine if they need MRIs. Typically we do, because it's a recent trauma. We want to be able to see the injuries, prove the injuries, because that's what matters in a personal injury case. So we'll get the MRIs ordered. Once the MRI is ordered, then we know what we're working with. So we'll determine if they need to go see the pain management doctor, which I do have one in my office. And if they are deemed appropriate for that type of care, then we'll set up an appointment for the pain management doctor. And then we'll discuss how much treatment they'll need after both myself or you or the doctor have looked at the MRI.
Okay. Dr. J, what do you do in your office? What does that look like for you?
Well, in addition to getting images so we can understand what the next steps are, we do the care plan now works based on the patient needs.
Okay.
You may have to do some rehab, strengthening, exercising, the decompression, the laser therapy. So there's a series of treatment that we do based on the patient. So it's not a cookie cutter. It is patient based.
So let me ask you both, if you could set up 1,000 personal injuries offices wherever you wanted to, what would it have to have? What are the necessary things that it needs to have to be effective for treatment?
Rehab equipment, laser or shockwave, if not both, a decompression table. I would have a flexion distraction table with the drop pieces on it, automatic flexion distraction as well. So that way you can walk away. That's what I would start with. So I think that's critical for the type of injuries that we see in personal injury. You need to decompress the disc, because if you have a herniated disc, how are you going to get better if you don't use decompression? Right. The laser helps facilitate the healing. It speeds it up. So why wouldn't you want that? Same with the shockwave. And then the rehab, it's not very expensive to add rehab to your office, but super beneficial. And not only is it beneficial for the patient recovery, but it is beneficial for your bills, because they like to see the patients doing active rehab. So they'll tend to not cut your bill as much if you get them actively participating in their own rehab.
Gotcha. Are there any additional things that you have? Or I know you guys are partners, so are the offices pretty similar in terms of how they're structured?
They're pretty similar.
Okay.
In addition to the heat and electric stim and the segmental traction, we still have those.
Okay. So how long have you both been in practice? Let's start there.
2001.
So 23 years.
Yeah, roughly. Yeah.
Okay. Well, all right. So you started when you were like 17. Yeah.
Yeah, exactly.
50.
I know.
Yes, of course. What have you noticed have been challenges being personal injury doctors?
Well, I would say the biggest challenge for most doctors is waiting to get paid. A lot of people are discouraged from going into personal injury because your wait period can be 1 year. And I wait as long as 3 years. It's not the typical, but I'd say 1 to 2 years is what you should budget your reimbursement schedule for.
Okay.
And if you can get through that, it's actually not too bad, because it reimburses at a rate much higher than health insurance or most wellness patients could afford.
Right.
But who wants to wait 2 years?
Right.
So that's the balance. That's the balancing act.
So Dr. J, then what do you do in the meantime if that's the case? If you're a new doc, and we have docs listening that are thinking about maybe going into personal injury, they get a new patient tomorrow, they may not get paid for a year. What do they do in the meantime? Do they see wellness? Should they... What does that time frame look like, or that gap, I should say?
I think if you starting out, it's great to do a hybrid. Do some wellness and some personal injury.
Okay.
Your wellness will feed you today, but your personal injury will carry on.
So how do you get your new clients? How do you get new patients? What is that? Do they walk through your door? Do they just call here and find you? What does that look like for you guys?
It's about marketing and marketing any and everywhere. Don't be afraid to market to other doctors, attorneys, and just word of mouth. Just to let everyone you know. If you are trying to do personal injury, you let everyone you know. Please let anyone you know who's been in a recent accident, some type of personal injury, give me a call. Attorneys, as I mentioned, and going to other specialties.
Okay. So I feel like there's a lot of networking involved, because I know you go out to functions as well. Is that time consuming for you? Is it more time consuming at the beginning or on the end? Like now that you're 23 years in, is it a little easier?
It's about the same.
Okay.
Yeah, it can be time consuming, but it's about creating a system and picking a day. We did marketing on Tuesday, so the week preceding that, have your lunch meeting set up. Would it be other medical doctors? Typically, that's who you're going to be marketing to, and more specifically, family practice and internal med doctors, because they have the ones to send. Why would you go market to a dermatologist,
right,
or OBGYN,
right,
or whoever? Because I practiced with the internal med doctor, so he got all the neck pain and low back pain patients naturally came to me.
Right, it makes
Any
sense.
musculoskeletal. If you're marketing to a pain management doctor, you're kind of in competition with them. So the medical doctor most of the time doesn't want to see third party insurance, so they're glad to have someone to push the patient to, which would be the chiropractor that doesn't mind the third party.
Okay. That makes sense. So I know, Dr. Jones, in your office, you added, or you have this second arm of the business. It's pain management. Can you talk to me a little bit more about what that looks like? Because I feel like pain management has always been kind of third party, right? Somewhere else, we let somebody else take care of that. But you're not doing that. Like, I feel like you tackled it head on and said, I'm going to put it in my office almost in a way where you can control it. Can you talk to me about what that looks like?
Yeah, so typically most chiros will send their their patients to other doctors, pain management or ortho, which is fine. However, I saw an opportunity to bring it in-house. So what that means is that I have an integrated office. Part of it's chiro, part of it's regenerative medicine. So when there are things outside the scope of chiropractic, instead of me referring it out and losing control of the case, because the doctor might start doing things way beyond what we initially sent them for, now I can communicate with the doctor because he's right next door.
Yeah.
We're on the same page. The bills don't get out of hand. The treatment doesn't get out of hand. So I just like it a lot better. The patients can give me feedback. We were all in the same office, and it just makes even negotiating the bills easier.
Yeah.
The collections, the attorneys like it better because they're dealing with one office.
Right. So when we say pain management, I think a lot of you guys, our listeners, are thinking, oh, he's offering some type of medical treatment. There's some medicine involved. But that's not the case. That's not the type of pain management you're doing. So can you be more specific about what that looks like?
Yeah, so we do regenerative medicine here, also known as stem cell. So we typically do PRP, where we withdraw your own blood, centrifuge it, and then we take the nutrients, extract the nutrients, and inject it into the joint or the area where it needs to receive the PRP. This is more of a natural medicine. I know the injection portion doesn't sound natural, but you're using your own blood. So we're not using steroid injections or anti-inflammatories. We're basically using the body that made the body to heal the body. So the power to make the body to heal the body. And that's pretty much what we do. We've been getting a lot of good results with it. We've had several patients avoid knee replacement. They were scheduled for knee replacement, but they did 2 rounds of the PRP and they are no longer considering it.
Wow.
Yeah.
That's amazing.
It's beautiful. I love it. I think every office should be looking for either integrating it or having a partnership with a provider that does.
Yeah.
Because it's so much more effective than doing the steroid injections.
Yeah. I mean, that cortisone, it's so hard on the bones.
Yeah.
It eats away at the cortex, right?
Right, yeah.
Like you're X-ray, so you know bones is your thing. I mean, bones is all our thing, but you know cortisone is horrible for our bones, right? So do you both see that PRPs is kind of going to be the wave of the future?
I think so. People are more receptive to it.
Okay.
A lot of patients have had the steroid injections. They gained weight from it, and it didn't help. And it was like triple the amount of the cost of what the PRP would be. So I think just overall, it's just more incentive to use the PRP to start with that at least.
Okay. Because I know that steroid doesn't last as long either. It's not as effective on everyone.
No.
So everybody gets a little bit different results for sure. All right.
Now, for a brief intermission.
Thank you for listening to the Chiropractic Connection. My name is Joe, and I work with Thrive Ortho and Spine, a local pain management and orthopedic clinic serving 7 communities around the greater Atlanta area: Decatur, Sandy Springs, College Park, Gainesville, Lilburn, and Woodstock. As a proud partner of the GCA, we are so appreciative to the chiropractors in the community who have trusted their patients to our care, and we look forward to continuing that partnership with those chiropractors. We would love to meet each and every single one of y'all, either through one of the GCA's many networking events or through an opportunity to meet and greet on a personal level. Please feel free to give us a call, 678-257-2547. Again, 678-257-2547 in order to meet and greet us and see how we may be able to better serve our communities together. Again, thank you for listening to the Chiropractic Connection, and we look forward to hearing from you.
Why choose Barber Orthopedics and Spine over a traditional hospital? Our award-winning orthopedic surgeons specialize in all parts of the body. We utilize cutting-edge technology with the most modern advances in medicine. We are on a mission with you to address your totality. We treat the person, not just the symptoms. Your wait is always 15 minutes or less because we value your time. We are privately owned, and we give you the personal VIP treatment you won't get anywhere else. We are a proud partner of the Georgia Chiropractic Association and offer our support to the entire chiropractic community. Barber Orthopedics and Spine. Exceptional care you can count on.
Now back to our featured interview.
All right. So if I were a new doc, or I'm still in school and we have docs that are in school listening, do you both take peak students? How can they find you? What do you suggest in terms of learning more about personal injury? Dr. J, what's your thoughts?
Something that I did when I was in school was that every grade, whatever area I was interested in moving to after school, I would go there during the breaks. Even I was thinking about going to Virginia.
Okay.
I would go there, get a hotel room, and spend 3 days and just go to local doctors
Gotcha.
and ask them. The key is to go and shadow as many doctors as you can, because you're going to learn 2 things. You got to learn what to do and what not to do.
Right.
So the more that you shadow, that you see what they do, how they do things, the better off you are.
Yeah, that makes sense. Absolutely. I think a lot of students, they go on these breaks and they're like, I'm going to Vegas, I'm going to Miami.
Mm-hmm.
But that's your time, because once you're out of school, you're out of school.
Right.
And, there's some docs who are open to letting you come shadow post-grad, but not that many. Like, they'd rather see you as a student. So I hope you students are listening and that you're shadowing doctors. And if you haven't been to a personal injury office, I have 2 amazing docs right here for you.
I volunteered before there was peak. So I didn't care. It was information I was after. So, there's a price to pay. Either you pay with volunteer or you pay with a consultant, and that costs a lot of money.
Absolutely.
They might not be a good one on top of that.
Speaking of that consultant, did you guys ever use like a marketing or coaching company?
I did. I used 2 of them, and the one that one was okay. I'm not going to name them because I'm not going to discourage someone from pursuing them. They didn't have the same philosophy. They were more wellness based, and I was trying to grow my personal injury practice. So finding a consultant that lines up with what your vision is what I think is key. Okay. Now, the second consultant group, which helped me integrate, we had the same vision. Okay. So it was a lot easier, and I'm still with them.
Gotcha. What about you, Dr. J?
So did 2, and they were both wellness, but One of them was very helpful, but the other was not. The reason why the first one was not is because I joined them right after I got out of school.
Mm-hmm.
I didn't have a practice yet.
Okay.
And they were telling me everything I needed to do. But he worked for everybody else who already had a practice, who had patients. I had nothing. So for you guys who are in school, just think about it before you hire someone, before you're in practice. Because if you're not in practice, everything that you're paying for,
Yeah.
when do you get to use it?
Right. That makes so much sense. That's a great point. Because I see that a lot of students will go to these conferences or on career days, or when they come to the school, they'll sign up with these coaching companies even while they're in school, and may not necessarily be looking to open a practice when they graduate or have the capabilities of doing it.
Which is what I advise against doing. I advise everyone to work with the doctor first. Because I did it backwards. I didn't do that. That was expensive.
So right.
That was expensive.
You always just been self-employed in that sense. Have you ever worked under someone?
Yeah, and the best thing I could have done was got there and worked for myself, fell on my face.
Okay.
Then I did work for a clinic for about 3.5 years.
Okay.
And I, even though I was, moderately successful on my own after making some hard mistakes, but stepping back and being employed really helped fine tune some things.
Okay, gotcha.
I wish I had done that first.
Yeah.
Yeah.
So good lesson to learn.
Mm-hmm.
Would you suggest doing during that time frame, trying different docs? I know you had said shadowing, on the breaks and things like that, but during those first few years when you're out of school, if you don't have the means or don't know what you want to do, wellness, personal injury, a little bit of everything, or what are your thoughts on who to work for? So did you work for a personal injury doc? Okay.
I did both wellness and personal injury.
Gotcha.
So I was able to say, I've seen full wellness.
Yeah.
I've seen full personal injury.
Okay.
And, it's just as much energy and effort in a wellness practice, if not more, than it is in personal injury as far as getting patients in. And keeping them in, it's probably harder in wellness.
Yeah.
So if you're going to get out there and you're going to put your energy somewhere, why not put it where you're going to get a better compensation? And you're actually really helping, not that you're not helping people in wellness, but you can really see, you have tangible proof on what you did when someone comes into your office limping, bent over from low back pain or what have you, and 8 weeks later, they're back to normal.
Okay. That makes sense. Did you guys acquire any additional skill sets? I know you did some auditing. I know you're an expert in x-rays. What other things do both of you have that you think added into your success?
Well, I think the key is to always be a learner.
Okay.
As long as you're in practice, as long as you're alive, you should be learning.
Yeah.
So I don't know if there's one thing that I have, but I would tell you that I'm constantly reading. If there's a conference, I want to be there.
Okay.
Whatever the newest technology is, I want to know about it. I may not use it all, but I want to learn about it.
Right.
Because there may be a patient that's the one missing piece.
Gotcha.
So how do you know if you don't keep up to date with things, then everything's going to pass you by.
Right.
You have to keep reinventing yourself, not forgetting what you've done. Everything you've done, that's your base. But you have to keep adding to your tool. Those are more tools that you're adding. And over time, you get better, but you should never stop.
Yeah, absolutely. And so you mean beyond the basic minimum credits that we need per year, right?
Correct.
Yes. So that's like baseline. That's just to keep your license. You're doing the additional things.
Correct.
Yeah. And I think you two are as well, right, Dr. Jones? You do some of those additional trainings and
yeah, I mean,
like you're always doing something new.
Yeah, basically whatever your focus is on your practice, so if it's wellness, become the best wellness. So for me, with certifications, personal injury, how to document to bring more value to the case. how to do narratives, whatever's going to enhance what you do within that field. So I want to be great at documentation, so the attorneys know, hey, he documents well. I can read his notes well. How to treat herniated discs. I attend seminars like that because the majority of my patients have that. How to use laser effectively. So when I do my CE credits, I'm focusing on those disciplines that will enhance my practice.
Okay. I appreciate that. I mean, I think it's important that we're lifelong learners. What is the future look like for the two of you? 23 years in practice, that's a phenomenal career. You both are very successful. What's the next phase for you both?
My son is, I have 3 sons, but my middle son is currently a second quarter student at Life University. So I think for now, I'm trying to make sure that I have a great foundation for him.
Okay.
And guide him when he needs to be guided, and allow him to be great enough to fly.
Yeah. Will he be joining you in practice, or are you going to help him set up his own thing? Does he get to be legacy and you hand it over to him? Or are you going to make him work for it?
Well, legacy and work for it.
Okay.
But that's my job, is to set him up, to get him to take over.
Yeah, I love that. You're going to be on the generations wall.
That's the goal.
Yes, I love that. That's awesome. We need more of us. It's Black History Month. We need representation in chiropractic. Dr. Jones, what's the future look like for you?
Essentially management.
Okay.
Growing the practice. Yeah, not so much seeing patients as much, but just growing it.
Do you guys ever see yourself in a teaching capacity?
I would like to one day. Yeah, but I would have to control the curriculum to a degree, because and really, because I need the students really need the business side of it. Really, I think the last year chiropractic school should be on how to run a practice.
Yeah.
Honestly, or make it a year longer. I don't know what it is, but the peak program is great now that they have that.
Did they have the peak program when you were both in school?
No.
Oh, really?
That's why I was saying volunteering, because I had to go volunteer for doctors. I would volunteer. And the thing about volunteering, you guys, don't just show up once a week, or be consistent. So when I volunteered, after the first week, he gave me a job. And then I was shutting down his office at night because I was consistent. And all the other students would come in, shadow him for a day or two, show up late.
Right.
But he saw something in me to give me a job within a week.
That's
I was ending up shutting his off. I was the night manager.
Right.
Yeah.
Wow. I didn't realize that peak program wasn't there.
No. So you had to figure it out yourself.
Yeah. Yeah. You guys really were bootstrapping back then.
Yes.
Volunteering, your pay was knowledge. So there's not a price on it.
Yeah.
So no matter how much the doctor would have had to pay me, he couldn't pay me enough. And again, from them, I learned patient flow. How did I want my office to run? What are the steps from beginning to end? And again, what to do and what not to do.
Right.
But that was the pay. The pay was showing up, like Dr. Jones said, be on schedule, show up as if you're getting paid.
Right. Yeah, sometimes you can't put a price on experience. That's for sure. All right, guys. So before we finish, if you could go back in time and give your younger self some advice, what would it be?
Well, it would have been to work with someone.
Okay.
Not just take any job or position. Write down what kind of practice you want and try and find that position that mimics it as much as it can. And not when you do work for someone, don't just learn the clinical part. That comes easy. Really learn the business part, learning how to do set up an LLC or an S corp, when to get you a good accountant, start buying some of your equipment now. That's a whole nother podcast.
Right.
How to start a practice under $10,000. So that
sounds like a great topic.
Yeah, I can show you.
Yeah.
But that's definitely a podcast.
Yes, absolutely. That could definitely be an episode. I'm making note of that. Stay tuned. Dr. J, what would you tell your younger self?
Know what you want when you're starting your practice. Don't be in a hurry, but don't be too patient. Just be at a good pace.
Yeah.
Work on your credit while you're in school, because access to funds That's the biggest thing that you can do.
Right.
Always look ahead
Mm-hmm.
and don't expect to live day to day on the checks that's coming in. Have a budget conservatively and live off of that. And put everything back into your practice until you get it to how it's supposed to be.
I hope you guys are listening. These are some words of wisdom from docs who've been doing this for quite a long time. So I want to thank you both for spending some time with me today to go over this topic that we have not yet covered. Dr. Jones, Dr. J, it's been a pleasure.
Thank you for having us.
Thank you for joining us. If you guys have any additional questions, you can send it to us at the GCA podcast for Dr. Jones or Dr. J. Dr. J is located in Jonesboro. And Conyers. And Dr. Jones is up here in Southwest Atlanta.
Creek, South Fulton.
Yes. So you can have Dr. Jones. This is my doc. I'm just kidding. You can call him, but he's very busy. But give us a call. Reach out if you have any questions about personal injury or PRPs. These gentlemen are very well versed in both of those, and I'm sure would be happy to answer any of your questions. As you can see, they're extremely passionate about what it is that they do. So we've made another connection today here on the Chiropractic Connection, and I will see you all next time. Bye. Our executive producer is Dr. Amber Jackson. Production staff is GCA Communications and Event Coordinator Sequoia Gonzalez. Our hosts are Dr. Deborah Little, Dr. Ben McDowell, and me, Dr. Amber Jackson. Special thanks to our podcast founder, Dr. Noel Steinley, and Public Relations Chair, Dr. Naila Smith. We thank you for listening, and we want to hear from you. Please send us a comment or a question to sgonzalez@gachiro.org. You may be featured in a future episode. You can also find us on iTunes, Spotify, Audible, and the GCA website at gachiro.org. Please subscribe, rate, and review us. Don't forget to follow us on your social media channels, Facebook, Instagram, and Twitter. The views and opinions expressed on this podcast are solely those of the participants and are not necessarily those of the Georgia Chiropractic Association or its employees.